Hi, I'm Paulina Colombo, an epidemiology doctoral student at the University of Arizona, and today I will be introducing my proposed project, Foundational Research for ASPIRE, or the Antimicrobial Stewardship Platform for Interfacility Record Exchange. This project aims to optimize interfacility communication for better management of multi-drug resistant organisms, or MDROs, through research that will inform implementation of a tool to facilitate standardization of patient transfer information. Let's begin with an ideal patient transfer scenario, which aligns with Arizona state law mandating communication of MDRO status. A patient is diagnosed with an MDRO and subsequently needs to be transferred. The transferring healthcare facility prepares an interfacility transfer form and ideally coordinates sharing patient information with the receiving facility through a common electronic medical record system. Once transferred to the receiving facility, the patient is integrated into the new care environment, where providers have all necessary information for proper care and establish channels for follow-up as needed. However, this ideal process frequently breaks down due to a lack of shared EMR systems and other communication failures. These issues can compromise infection control during transportation and also disrupt diagnostic and antimicrobial stewardship practices at the receiving facility. As a result, patients may experience repeated clinical assessments or treatments, delays in appropriate care, extended stays, or further transfers. The repercussions of these communication breakdowns also compromise infection prevention and can increase MDRO transmission in healthcare systems. Existing studies, including our lab's research, identify key challenges in MDRO interfacility communication. In a SHE Research Network study published in 2021, 72% of surveyed hospitals had MDRO notification protocols, yet only 44% of those with protocols communicated consistently versus 13% without protocols. Most respondents also cited a lack of standardized methods as a major barrier. Despite several states, including Arizona, mandating MDRO status communication during patient transfers, evidence on the law's effectiveness and practical implications is limited. Our project seeks to fill this research gap. Our lab's recent analysis of antibiotic prescribing practices in a long-term care facility required the exclusion of over 20% of all prescription events because they were issued pre-transfer. This underscores the regularity of transfers and the need for improved communication to maintain antimicrobial stewardship. Bridging these gaps is essential for improving MDRO management and patient safety during transfers, driving our efforts to innovate communication solutions. This project supports building an evidence base toward the development of practical solutions. We propose an explanatory mixed methods research design with two objectives. First, to quantify the current state of MDRO transfer communication in a large Arizona skilled nursing facility, and second, to employ qualitative methods to identify barriers and facilitators to interfacility transfer communication. For AIM 1, we will analyze MDRO transfer documentation completeness at a 300-bed Arizona-based skilled nursing facility. I have collected and analyzed pilot data for a separate project using this facility's EMR system, which allowed me to assess feasibility for this aim. For patients transferred to this SNF over a 3-year time period, we will abstract EMR data to define transfer documentation as either complete or incomplete based on the criteria from the Arizona Department of Health's Interfacility Infection Prevention Transfer Tool. This includes key details like isolation precaution status and the presence of an MDRO. Using the abstracted EMR data and any available transfer-related documentation, we will employ logistic regression analysis to model predictors of complete documentation status, including characteristics of the patient and transferring facility. AIM 2 seeks to understand barriers and facilitators healthcare workers encounter during MDRO transfer communication processes. To achieve this, we will conduct 14 key informant interviews with infection preventionists, frontline care providers, and case managers from both acute and long-term care facilities. Leveraging framework analysis, we will apply preliminary insights gained through brief interviews I recently conducted with 20 stakeholders for an NSF social innovation program to inform our interview guide. Following these discussions, we will plan to construct an initial analytical framework based on key themes such as communication challenges, facilitators of effective transfer, adherence to regulations, and the impact of technology. This framework will guide our use of MaxQDA software to systematically organize and analyze the data. Our lab's prior experience with qualitative research in long-term care settings will streamline project planning, and a stakeholder network gained from the NSF program will assist in recruiting participants. We've allocated a total of $20,000 to our budget for direct labor, participant support, and other direct costs such as graduate tuition remission and software for data analysis. This foundational research for ASPIRE encompasses two central aims of my dissertation. The project will contribute to future implementation science by developing standardized informatics solutions to enhance interfacility transfer communications, as well as strengthening literature on this topic from the perspective of a facility located in a region with high social vulnerability. Once ASPIRE is conceived and piloted, understanding the implementation among a diverse network of health systems such as the SHE Research Network will be critical to answer questions about feasibility and scalability. Thank you to the reviewers and committee for considering our project for the 2024 SHE Epi competition, and thank you to my team, Drs. Catherine Ellingson, Sheila Gephardt, and Justin Hayes.